Side of lymphoma, I think. All right. Again, if you touch it, it tells you where it is. So it's nice because you can zoom in. If it was a real cadaver, the only way you can zoom in is just to get closer to it. So we'll start with muscles of the face. If it ever gets on there wonky or it's weird, you can see the face and it'll bounce back to where it came from. All right, so the first muscle you need is occipital frontalis. It tells you exactly where it is. So there's occipital frontalis. On top of the temporal bone, that's the temporalis muscle. Not those little three that connect to the ear, those are irrelevant. That's the temporalis muscle on top of the temporal bone. On top of the nasal bones, we have the nasalis muscles. And then we've got these muscles that make a circle around the eye and the mouth. So there's orbicularis oculi, there's orbicularis oris. Alright, so here's the zygomatic bone. And you can see there are two muscles right here that connect to the zygomatic bone. The little ones on top, we don't care. The big ones right here, that's zygomaticus major. It goes from the zygomatic bone down to the top of the mouth. Your upper lip would sit right here. So to raise the upper lip, one of these muscles has to get shorter. It's that one, not that one. Levator labii superioris. And if that muscle gets shorter, it brings the top lip up. And then down here on the bottom, that's depressor labii inferioris. So lower the bottom lip. The one that goes to the corner of the mouth here, that's depressor anguli oris. I said there's a muscle in the cheek right there, that's the buccinator. And then the big muscle for chewing right there is the masseter. In order to see the next muscle decently, we're going to take something off. If you ever need to take a piece off, you get the little lady's face with a question mark, and then the one that's got a missing piece. The missing piece key will take stuff away. Like that. Like that. You're ready. Okay. If you take something off that you didn't need to, hit undo. Alright, so the muscle that we need next, there's the sternum, there's the clavicle, sternocleidomastoid, big muscle in the neck. On either side, sternocleidomastoid. We'll take it all the way back around to the back so that we can see where it connects to the mastoid process of the skull there. And this big muscle that makes this sort of shape on the back, that's the trapezius. And just like we need to lose that platysma, we'll lose the trapezius muscle there. Underneath the trapezius, we can still see sternocleidomastoid. And if we move one in from sternocleidomastoid, there's your scapula. So the next muscle in is the levator scapulae. When that muscle gets shorter, the scapula comes up. You move one more in, you get splenius capitis. When that muscle gets shorter, it pulls your head back. Between the scapula here and the spinous process of vertebrae, you've got this big muscle right there, that's the rhomboid major muscle. The big muscle that covers most of your back down here is latissimus dorsi. And it goes all the way back up and kind of under the arm. Here's this one with a jagged edge on it. That's the serratus anterior muscle. And then we're all the way back around here to the chest. And we can see pectoralis major. We'll take one of those off. And underneath pectoralis major, we see pectoralis minor. Do it. All right. Any muscle in between the ribs and intercostal muscle, but we're not going to worry about that. All right. So then down here on the abdomen, we have our abdominal muscles. The most superficial abdominal muscle there is the external oblique, and you can see like those fibers are running in diagonally like that. We'll take that one off. Go. Underneath the external oblique muscle, the next muscle is the internal oblique. And you can see here how thin those muscles are, like they're really thin sheets of muscle. That deeper one is the internal oblique. If we take that one away, under that, we can see this one that goes straight up and down. That's the rectus abdominis. There. And then we can see this one that runs straight across. That's the transversus abdominis, or the transverse abdominal muscle there. If we lose both of those guys, in the middle, you see the diaphragm. The diaphragm is the only one on the inside that you need, right? It's the lungs sit right on top of it. It separates the thoracic and the abdominal cavities. So there's the diaphragm. Incidentally, there's your psoas major muscle, iliacus. So all the other muscles are still here, but for our purposes, it's just easier for the exam to use the models so that we can spread the things out. Your exam for this will be like a real cadaver where we just pin it. If I had a real dead guy, take the skin off and we'd stick pins in it